The Marjorie Stoneman Douglas shootings last Wednesday, you know that story. Virginia Tech, 32 dead, Sandy Hook, 27 killed, Columbine, and many, many more. And that's to say nothing of the mass shootings that don't take place in schools, such as the one we recently had out in Las Vegas and the Pulse nightclub in Orlando last year. One common thread that runs through all of that is the first responders to these situations. Can you tell us a little bit about how they will be affected by PTSD and actually what PTSD is?
Sure. PTSD, post-traumatic stress disorder, is basically an emotional reaction to a significant stressor. Definition of that stressor has to be either life-threatening or threatening to one's in a serious, harmful way. If it's prior to 30 days after the event, we just call it an acute stressor, which still is very serious. But post-traumatic stress is something that can stay with a person for months or years.
What are the ways that the first responders, and we'll just use the shootings of last week as an example, what are some of the ways that those first responders would be hit by PTSD?
Well, PTSD includes basically issues of intrusion, where a person begins to have memories of the event, or things trigger a memory of an event. There may be heightened irritability, impaired concentration, some heightened arousal that also occurs. Then at the same time, there's periods of avoidance where they seem to almost be numb to certain things that are going on around them. There'll be changes in their mood, their sleep patterns, appetite. You'll see significant changes. Even for the children, certainly the children that were leaving that school and stepping over blood or going by bodies, they're going to continue to have memories of that event.
A lot of time the PTSD victims don't even know they've got it.
Right.
Until it's pointed out by loved ones, friends, coworkers. How do you help victims of PTSD deal with that?
Well, one way is that you try to get them to quit avoiding the trauma and to acknowledge that, yes, they experienced something very, very traumatic, and to acknowledge that they're having emotional changes in their thinking. You get them to quit avoiding. The more they try to suppress it, the more they try to just bury it, the worse it's going to be.
Right. So they're dealing with obviously a big stressor, as you put it, and most people's way of dealing with stress is self-destructive.
Very often it is, particularly, again, they have a pattern of continuing to try to avoid it. Sometimes with adults, they'll avoid through alcohol or drugs. Sometimes it'll be through engaging in other behaviors to distract themselves.
If you could have 10 minutes with the group of first responders that responded to the Florida shootings last week, what 2 or 3 things would you say to them briefly in addition to that?
Well, actually, there is this process that we call stress inoculation, or process of helping people work through what happened. I'm sure that has already occurred. But you want them to begin first describing what happened around them. You then want them to begin talking about what were the emotions. That leads to what were you thinking at the time. And then that leads to what did you then do to try to handle it. You want to take them through every step of that so they can relive it and become much more aware of what they're experiencing.
I know a lot of the first responders that worked here during our Fallen 5 shootings a couple of years ago. They certainly took advantage of the kindness of the mental health community here in our community, and we want to thank you for that. Wish we had more time, Dr. Bill Hillner. Thank you so much. We hope you will come back at any point. You can find out more about Dr. Hillner at the Relationship Therapy Center. They're out in East Brainerd off Jarnigan Road. The number 855-4091. Again, 855-4091. And the website, relationshiptherapycenter.com.